Good to have you with us. You're watching The Big Story with me, Avni Raja. Let's straight first focus on the city of Mumbai, where the numbers have been spiking for the last several days. Now, Mumbai has recorded over 10,000 COVID cases. The Health Ministry has now formed a special team to review the situation in the city. In fact, this team, which is being led by Health Ministry Joint Secretary Love Agarwal, will comprise of health experts and doctors as well, who will visit the city of Mumbai. The move by the centre comes just days after Union Health Minister Harshvardhan expressed concerns over the rising number of cases in the city. Those, of course, the details coming in as far as Mumbai is concerned. Now, this is a special team that's going to review the situation in the maximum city at this point in time. Remember, now 10,000 cases of COVID in Mumbai at this point. This also includes 250 police personnel, 250 cops who have tested positive for the coronavirus. Now, this central team, which will be comprised not just from the Health Ministry, but also of doctors and experts who will be coming to Mumbai and figuring out the situation on ground. What are the other measures that can be taken? What is the preparedness of the city to deal with this kind of a spike in cases at this point in time? So those details, of course, coming in. This move by the centre just days after Union Health Minister Harshvardhan expressed his concerns over the rising number of cases in Mumbai and in Maharashtra specifically as well. Those details coming in. Remember, we are now at more than 10,700 cases of coronavirus in the city. And of course, there are hospitals which are filling up fast. There's a shortage of healthcare professionals in Mumbai as well. There's also confusion as far as the government orders are concerned, with new changes being made every day over what can and remain open and what does not remain open. Ayushman joining us for more details. Ayushman, help us understand, of course, this team now, we do know that the Union Health Minister expressed concerns over what's happening in Maharashtra, specifically in Mumbai. But tell us who is going to be part of this particular team and what is going to be on the agenda once they come to Mumbai.
Currently, Avni, we have been told by the sources in the Health Ministry that this team, which comprises of experts, doctor and a joint secretary from Health Ministry, will overview as to what is the situation on ground, and they will also be looking at the current scenario as to why the cases number have seen such a spike in in Mumbai as well as Maharashtra. Currently, we have been told, because we know that the IMCT teams have also gone there. And if you remember, there was also a team constituted by the Health Ministry to coordinate with state. There was one team specially made for Mumbai. So this again comes a new development from the Health Ministry, where a joint secretary and a team of doctors and experts has been sent to assess the situation. Currently, it has not been yet disclosed as to what will be there on agenda, but definitely the scenario which we are witnessing right now, in which a lot of number of cases are coming up, that definitely will be a key focus for the team that is visiting Mumbai.
Right, and Ayushman, do we know how long the team plans to remain in Mumbai? Which are the areas that they would be visiting? Do we have any of those details at this point?
Currently, Avni, the detailed agenda hasn't been shared to what the team's priorities will be there, because the number which we are witnessing right now, that remains a key focus on the meeting with stakeholders. That hasn't been disclosed yet by the Health Ministry, and we are also trying to check with the sources to what will be on agenda, but that is not clear. But for now, definitely we can tell you that this team has gone in order to assess as to what can be done right at the present moment in Mumbai, because it is, and currently the situation is not very much in control. That is why the Health Ministry has felt that for the first time, apart from the IMCT team, interministerial central teams, and also an advisable team which was made, there is a third team to visit. Right by one of the most important person currently in the Health Ministry, Love Agarwal, going there, Mumbai, and assessing the situation on the number of cases that we are witnessing right now.
All right, Ayushman, thank you so much for joining us with all of those details. Meanwhile, we're getting some breaking news from Mumbai. Now, this is with respect to the video that has surfaced about Sion Hospital. The Mumbai civic body has said that they will be probing. A committee is being formed to probe into the video's authenticity. BMC also pointing out the procedure that needs to be followed when a person dies due to coronavirus, and also saying that it often happens that relatives of COVID patients don't claim the body. In such cases, the hospital then informs the disaster cell, and after the procedure is followed, the body is then shifted to the morgue. So just highlighting the procedure that is followed, but also saying that they will be probing the video about Sion Hospital. Disha joining me for more details. Disha, take us through what BMC is really saying as far as this particular video is concerned.
Well, Avni, finally, the Mumbai civic body, the BMC, has put out a statement, has issued a statement clarifying regarding the Sion Hospital clip. They have finally inquired, they have finally ordered an inquiry into this entire matter. In fact, they have gone on to say that they will set up one committee which will investigate the authenticity of the video. Because remember, even the Dean of the Sion Hospital has confirmed that the video indeed is of the Sion Hospital, but they do not really know whether it's a recent video or an old one. So the BMC says that, of course, according to the COVID guidelines, it's been mentioned that post-death of any COVID patient, within 30 minutes, the dead body should be handed over to the relatives in the presence of the police. But in such a scenario, what the hospital really faces is the problem that many times relatives don't turn up, hence hospital informs the disaster cell officials, and they complete all the procedure and move the body to the morgue. But in such cases, of course, when the morgue also is full, running out of capacity, the hospitals do not really know where to keep the body. So, of course, as far as the authenticity of the video, that will be, investigated by the committee which has been set by the BMC.
All right, Disha, thanks so much for joining us with all of those details. We'll, of course, have to wait for that investigation to find out when this video was actually taken. But let's also give you a sense right now of what's really been happening in the city of Mumbai. Now, weak health infrastructure is turning out to be a major challenge and a hurdle for Mumbai in this war against coronavirus. Amid the soaring numbers of coronavirus cases, there's a shortage of beds for COVID patients, which is just adding to the problems. Union Health Minister had approved Maharashtra government's proposal to use ICUs of defence and railway hospitals as well in Mumbai for treatment of positive patients. But these ICU beds are said to be used only in cases of emergency. But he's also instructed that the state health minister should ensure that these ICU beds are used as the last available option. So that is supposed to be as a backup option in cases of dire emergencies. Now, with the number of patients also rising exponentially in Mumbai, Mirna has accessed the blueprint of BMC's plan as well. So essentially, just to take you through what the civic body is planning to do at this point in time, first of all, setting up of more beds in Corona care centers. The aim really is to have about 34,000 beds in the next 15 days. Facilities for asymptomatic patients in dense slum areas also. Asymptomatic cases to also be shifted to makeshift isolation centers. And beds for critical cases also have been increased from 3,000 to 7,000 to 4,750 beds. So that is the special focus at this point in time, which is being given to the number of isolation beds, and BMC is targeting about 76,000 beds by the end of May, and new isolation beds are being readied at various different locations in the city as well. Disha is still with us. Disha, of course, this is going to be the biggest challenge that we have been talking about in the past as well. But now with the number of cases spiking, we're actually seeing the impact of all of this. But help us understand, what is the plan now? What is the preparation level that the civic body and the state government is doing in Mumbai?
Well, Avni, as we all know that in this week alone, Mumbai's positive cases is nearly 2,000. So this is the huge number that we are talking about. And keeping this in mind, of course, the BMC is planning to enhance the treatment as well as the isolation beds across the city here in Mumbai at various COVID centers as well as in various hospitals where the COVID-19 patients are being treated currently. So, for instance, the BMC is planning to set up more beds in the Corona Care Centers from the current 14,000 to 34,000 beds. And the timeline that they have set is in the next 15 days, that is in the next 2 weeks. These facilities basically are being set up, Avni, for asymptomatic positives from highly densely slum pockets, and they will be kept in these centers where, of course, the BMC has spread across the city. Another point because the capacity will be enhanced from 3,000 to 4,750 in various specifically COVID-19 dedicated hospitals like the Nair, KEM and Seven Hills for that matter. This is only to ensure and keeping in mind that how the cases are increasing every day. Of course, there should be no shortage of beds and people should not suffer as far as the patients are concerned. So these are certain preparations on the ground level that the BMC is keeping in mind.
Absolutely, Disha. Thanks so much for joining us with all of those details. In fact, these several new beds which are being readied at different locations in the city as well that Disha was pointing out too. Let me just take you through some of them. For example, Mahalakshmi Racecourse is one area where 300 beds are being prepared. Nehru Science Centre, about 100 beds. Nehru Planetarium, 200, and BKC's MMRDA grounds as well, 500 odd beds over there. So these are the several areas where more beds are being put in place at this point in time. Those, of course, are the details at this point. So essentially, the target is 76,000 beds by the end of May, and we are seeing, over 10,000 cases now in Mumbai of coronavirus at this point in time, which is becoming a rising cause of concern. Several hotspots in the city and several of them in dense areas and slum areas where it is even more difficult to actually quarantine people and isolate people. So, of course, those are some of the concerns that are coming up right now.